Big milestone was reached yesterday, 250,000 COVID vaccines given in one day. It's a target that many detractors thought would be beyond the logistical capabilities of the health department. It has to be said, it's certainly a team effort, with the private sector playing a major role in helping to run vaccination sites. While the numbers of vaccinations are growing, there is concern about who is getting vaccinated. Some 1.5 million private healthcare patients have received the vaccine, compared to over 3 million public health patients. Now, as a percentage of those two groups, private vaccinations outstrip public by almost 3 to 1, nearly 18% to 6%. Let's discuss these issues now with Malan, Executive Director and Editor of the Bhekisisa Centre for Health Journalism. Hello, Mia. Thank you so much for joining us. So, Health Department saying we reached 250,000 jabs yesterday. Many thought we would never get there. 1 million jabs every 4 days and a plan to vaccinate 35 million people by Christmas. This is certainly good news, isn't it, Mia?
I think it absolutely is good news, Sally. I think it's what everyone wants, just to have the vaccination campaign roll out as fast as possible. And that's obviously going to help us to get as many people protected as fast as possible. And the main thing we want is to have people protected against hospitalization and death. And we've certainly, in other countries where there's now real life data, for instance, the US and the United Kingdom, we've now seen in their waves where people still got COVID even though they were vaccinated, but that they did not die and they did not end up on ventilators. If you look at the United States, in their latest figures that they released, almost all the deaths, 99.5% of the COVID-related deaths, are among unvaccinated people. So the big difference if you're vaccinated is you're going to be protected against serious illness. You're not going to end up on a ventilator and you're not going to die.
Yeah, absolutely. An important message. Dr. Nicholas Crisp saying as well, they want to give 35 million South Africans a dose, one dose at least by Christmas. Well, the only caveat, of course, is supply. We know that 900,000 doses of Pfizer are due to arrive on Sunday. What's happened to the Johnson & Johnson doses coming out of the Aspen factory in Gqeberha? Are you keeping an eye on that?
So I've certainly asked about it and I didn't get answers. You may recall that on eNCA, the director of Aspen said about a month ago that we would get 1 million doses from Aspen, and those doses then never arrived. Instead, we got J&J doses from the United States, and those were essentially doses that the United States didn't use. It was allocated to the United States, and then there wasn't an uptake of it. And we then got those doses, and that's why they have such short expiry dates and why we're using them for essential workers so that we can use them up quickly. But we are getting more J&J doses. The health department last night did say that they now have delivery dates, hopefully for the first week of August. They haven't given specifics on the delivery dates, but they did say that they finally did get some sort of indication from J&J. We don't have numbers yet. We know that we've bought 31 million doses and we've only received 1.5 million doses. When it comes to Pfizer, they've pretty much stuck to their schedule of delivery. And as you've said, we're getting 900,000 this weekend. And the health department last night said we're getting 5.8 million doses in August. So we are getting some of those doses in, and it doesn't look like we're going to run out of doses. We have about 15 days of stock at the moment, the health department said last night. But that is without the incoming doses and without the additional J&J doses that we will receive.
So we've got quite a comfortable cushion. I want to just stick with this J&J story. You say that J&J doses are coming in August. Is that filled and finished in Gqeberha, or was that not clear?
We don't know. Details was not released by the health department last night, so it could be the Gqeberha doses, because we know that they're going to produce 17 million, as the president said about 2 weeks ago, doses that will go to Africa. We do not yet know. No figures have been released as to how many of those 17 million doses that they're producing over the next 3 months will come to South Africa. So we don't know whether the J&J doses that we will be getting will be coming from the United States, or will it be coming from the Leiden factory, or will it be coming from Aspen? It will probably be a combination.
It's strange, though, because we know that after the Baltimore factory mix-up, where quite a few doses of vaccine at the Aspen factory had to be destroyed. There was a huge move to really pick up the pace and ramp up production, and it all seemed to be going swimmingly. So this radio silence is really worrying, because it was touted as something really proudly South African and really wonderful. You know, obviously you don't have clarity, but do you suspect there's something going on there, Mia?
No, I don't think there's much going on other than the fact that J&J couldn't for months use their factory in the United States to produce doses that were ordered already and that they had planned to produce. So there was a standstill of production, and I think it's very hard to make up that lost time. I do, however, think that J&J has been really not very forthcoming with communication. I've certainly tried to get answers. I know of many other journalists who've tried to get answers, and they're not very forthcoming with information. And I think because there's a bit of a lack of transparency, it creates an environment to ask many questions and to think there's conspiracies. But I think it's important to remember that they lost a lot of production time. And I do recall that they said that they're going to try and make up for that production time by expanding their Leiden factory in the Netherlands, but that it would take time to first equip the factory and expand to be able to produce more doses. And they, about 2 months ago, they said that would happen in July, which is sort of where we are now.
Okay, well, we'll keep an eye on that one. Let's talk to the vaccine equity issue now, because you tweeted this out yesterday, and it's an interesting stat. You know, we've got 9 million private healthcare patients in South Africa versus 50 million public. So obviously one group is much bigger than the other. The raw numbers obviously show 3 million public patients vaccinated versus, I think, 1.5 private. But when you look at a proportion of the group, it's very clear that if you're in private healthcare, you're getting quicker access. Is this due to the very obvious things, such as in private healthcare you can actually make a booking at a time that suits you? You've probably got access to a computer to get all the information you want about where to go, and you can probably get there under your own steam. Is that what's going on here? And if so, does it raise some questions about how well the government is supporting those in public healthcare?
So I think there's definitely an argument to be made that it's much easier for people with medical aid, because they've got more money and they've got cars and access to transport to get to sites. But I think there's also an issue that the Health Department to the Portfolio Health Committee in Parliament raised last night, and that is when they started to focus on essential worker groups such as teachers and health workers and police and the army. They were all groups that have access to medical aid. So they help to push up the figures among the medical insured. I do think that they also raised that particularly in townships, it's sometimes quite hard to convince people to get vaccinated, but also that the private sites where it's relatively easy to often get access are far from those areas. But I do think there are also good stories. If you, for instance, look at Limpopo, which is a very rural and a relatively poor province, they are doing the best in the country, with the largest proportion of their adults having been vaccinated, about 6.8%. And that is far above the average of the country, which is 5.1%. That was the figure by yesterday. And what Limpopo did was to really involve community leaders. They took vaccinations to people. For instance, some of the vaccinations are done in tribal offices, and those are uninsured people. So something all of the provinces in the country can do is to try and learn from Limpopo to see how did they manage to get so many people registered on the EVDS. They had very, very high proportionally registrations in their province, and also to get the vaccinations out. And that is largely among an uninsured population. So it can be done and we can pick up. But it is a concern for vaccine equity, because as you may recall, one of the reasons why the government said they need to procure vaccines and not private institutions is so that we make sure that people who can pay for vaccinations and who have money don't take up all the vaccinations first, and then poorer people have to get them later. Pretty much what has happened out there in the world, right? With with the United States and Europe buying up all the vaccines first. And now we're in a situation where, yes, the vaccines are available to everyone, but not everyone gets equal access to them. So we are going to have more projects to take the vaccines to people. But there are such projects starting to happen. For instance, at the Eastern Cape, at SASA points, there's mobile clinics where they take vaccinations to people. There's also some projects where they take vaccinations into communities. So I think they are starting to happen. They just need to be ramped up.
Yeah, absolutely. Well, important lessons to learn from Limpopo and the Eastern Cape. Fascinating information. Thank you so much. That is Mia Malan, Executive Director and Editor of the Bhekisisa Centre for Health Journalism.